Stay on with us because we have the health minister joining in on the phone line to give us a little more details on some of the curfews that have been implemented. Thank you so much for taking the time out, sir. To begin with, can you just clarify for us as of now, what are some of the restrictions that have been imposed in Maharashtra?
Yeah, corona being a really infectious disease, we had taken previously many steps, but further adding to that, we have now decided to close down the area of MMR, that is Mumbai Metropolitan Region area. It covers Navi Mumbai and Mumbai and then adding to this, Pune and Pimpri Chinchwad and Nagpur. These three metro cities also are in the total, the area which is to be kept closed for all the offices, private offices, corporate offices, then even the shops and all has to be kept closed from midnight today till 31st of March. And even the financial institutions like banking and stock exchange will remain open. The essential services, for example, the grocery shops and vegetable shops and all will be kept open. Also, the railways, the local lifeline of Mumbai will be kept running, and also BEST, that is the bus service, will be kept running. For the common people, those who are dependent on the public transport, and specifically those who earn their bread and butter daily on their daily wages, so they can use this public services. But keeping very close eye on these public services, because government is having an apprehension that the risk of infection will happen through these public services. So basically we are keeping very close eye. If we really couldn't reduce the load in spite of taking all necessary steps, then there is no alternative left than to close down the lifeline as well. So we are keeping very close eye. That's what I wanted to tell to the Mumbaikars, and seeing that if you can cooperate and if we can really lessen the burden on the public transport, we can keep them continuing.
Mr. Tope, I have a couple of questions for you. The Prime Minister yesterday in his, announcement, or rather speech to the nation, clarified about the Janta curfew. So come Sunday, which is day after, will you have essential shops actually open, or is it going to be a complete lockdown that Maharashtra will see?
The Maharashtra should see complete lockdown. It's an appeal from the Prime Minister, and we are also furthering it to the as the government of Maharashtra, to the people of Maharashtra, that the appeal made by the Prime Minister, we also support, and we also really should adhere to the appeal and should keep everything closed and work from home. That is an appeal.
Okay, so you're specifying that this is just for Sunday when the Prime Minister has urged the Janta curfew, right? When everything will remain closed. I don't want to get this wrong, which is why I'm asking you the question again on record.
Sunday means the entire, it is pan-Maharashtra we are speaking about, not only the metropolitan region of Mumbai and Pune, Pimpri Chinchwad, Nagpur. It is for pan-Maharashtra.
Okay. Fair enough. When is your next review meeting? Because like you right now clarified that public transport will be open because indeed it is the lifeline of Mumbai. But when is the next review meeting, or what are the parameters that you have in mind when you're going to take a review on whether to shut these essential services as well?
You see, the reviews are being taken every day, and we are very keeping close eye on the public places, basically the places wherein the gatherings, or wherein the crowd happens to take place. So public places, public transport is a point wherein we see a lot of people, it's a main logistic, I mean to say, and so people, they use that transport. And so we are keeping close eye. It's not like we convene a review meeting for that. We are continuously in reviewing, and so any time, any day, we can go ahead with that decision. If not, if the decisions taken at present are not found to suffice the purpose.
Sure. Mr. Tope, I'd also like some clarity, because as you would understand that, most of us as well are sort of maintaining social distancing, and right now your only mode of news is indeed, WhatsApp, which could be the most faulty medium of, reportage at this time and point. If you could just confirm to us, how many are the infected cases in all of Maharashtra, in Mumbai? What are the fatalities? And from the first time that the pandemic actually reached India, what have been the increase in number of cases that you've seen in both Mumbai as well as Maharashtra?
You see, the present update I can just put to your knowledge is 52. It is 52. Yesterday it was 49, and 3 more are added. But to my satisfaction, there are also cases which were found positive previously are now becoming negative, because after the proper stay of 10 days with no positive, with no sign of, symptoms and all. Now, if as per the protocol, if we take 2 swab tests and if they are found negative, then he or she is eligible for the discharge. So in that situation, 5 numbers are found eligible for getting discharged out of 52. And so I just wanted to the people of Maharashtra that yes, this is recoverable. Only 80% of the patients are basically found to be mild, and remaining 15% are comes in the category of severe, and 5% in the category of critical. The mortality rate, which we are told is not more than 2.5% to 3%. So it's not. At large, the public should not be scary, and should be confident, and also should follow the rules and regulations basically told by the government, and should be safe in the home, be in distance, keep social distancing. And these, if we do if you follow, whatever the instructions given by the advisories of Government of India and Government of Maharashtra.
Mr. Tope, Sure. Mr. Tope, just one clarification. You said the number of infected are 52. Is 52 the count of Mumbai alone, or is it all over Maharashtra, sir?
No, it's a total pan-Maharashtra figure I'm telling. Mumbai might be 7 or 8.
Okay.
And one point I will be more, to become more clear. Out of these, only 10 are found to be infected within the Maharashtra, and most of the cases are actually imported. The infection is imported from abroad. In 52, if we minus 10, it is around about 42 cases. Those are directly, they came from abroad, got infected there itself, and then they are here. So within the state, the infection has caused only 10 numbers.
Yeah, absolutely. I completely understand. We also have been getting reports that most of these infectious cases are people who are coming from abroad. So in that case, what is it that you're doing? How is it that you're cordoning off international borders? We understand that up until 31st March, or at least for the next 1 week, no international flights are allowed to come into the Indian borders. But beyond that, what are the checks and balances that you are keeping at the airports at this juncture? Because as we understand, there are some people who are getting that stamp that they have to self-quarantine, but some are completely going scot-free. So what are the checks and balances that you have in place at the airports?
I think to stop the infection at source, that the source is like the import of patients from abroad. That is the main source. If that source is stopped, or it is stopped, then I think the further infection can be controlled. That is very important point. And I think Government of India has taken the decision that after 22nd, no flights will be allowed to land in the Indian premises. So that is very important point which has been addressed, which has been taken to address the to contain this deadly disease. That is one point. And within Maharashtra, yes, we are quarantining people as per the protocol or the advisories of Government of India. We have arranged the quarantine places in Maharashtra. We have made rooms available, beds available, and also there are categories like A, B, and C. A means those who are above 60, senior citizens, but are found with symptoms. Those are called as A category. They are directly taken to the hospital, Kasturba Gandhi, where they are kept in the isolation, and the swab tests are taken, and further, if required, found positive, then further symptomatic treatments are given to the patient. Second, if B means they are senior citizens but not having symptoms, so they are called as B category, and they are quarantined in the facilities provided by Government of Maharashtra. C category means young people. Those are less than 60 years but do not have any symptoms, and so they are allowed to go to their home, but are asked to be at their home in isolation, and are also under surveillance of our team of people, those who phone them every day and are in kept contact. So in this way, there is a quarantine plan as well as the further treatment and the preparedness of the Maharashtra Government of Maharashtra for to combat this disease also is in place. Like all the doctors are well trained, then the ventilators and the ICU and even the isolation beds are also kept in place in all the respective districts, and especially in Mumbai, Pune, and the metros of the Maharashtra.
Okay. Now I want to come to the quarantine facilities, Mr. Tope. And, please understand that we are extremely intrigued and would like clarity from the best possible source, which is you at this juncture. You have a quarantine facility at Kasturba Hospital. What I'm trying to understand is whether or not this is enough. Can the infrastructure really support? Because as per our understanding, some of the five-star hotels in Mumbai were also being used for quarantine facilities. Would you need the help of private players, private hospitals and other institutions as well from the private sector, to really come of help at this juncture?
You see, the Kasturba Gandhi Hospital is not a quarantine place. It's an isolation. It's an hospital which is used for the positive patients, those who are found positive. There are 125 beds over there, and I think 10 or 15 are occupied at present. But mostly the suspected and the positive patients are only kept in the Kasturba Gandhi Hospital. Rest all, as I told, that the quarantine facility is in Seven Hills. It is a Seven Hills hospital, which there is no hospital activities being carried over there. But yes, it's a good hospital, newly constructed hospital. There we are having more than 1,000 beds over there to house so many number of 1,000 number of patients we can or passengers. I mean to say not patients, because patients we can say only to those who are found positive. But passengers can be quarantined in this area. Also, if some passengers they afford to stay in the 5-star hotels, for them 5-star hotels also has been booked at a very less rate, tariff rate. I mean to say the discounted rate of 30%, and they can live at their cost in the 5-star hotel as well. So these two facilities, and we are adding some more quarantine facilities from the government side. Like there are some buildings available now which provide many number of single flats or double beds or 2-room flats, which can be used for quarantine facilities. So the plan for quarantine facilities and all is being prepared by MCGM, that is BMC, Bombay Municipal Corporation, and it's a proper place, I mean to say, and we are all ready to face any case of eventuality.
Mr. Tope, but what will also really put us through the real test is how we manage to go through the next week and whether or not we do see a rise in cases, etc. So I want to understand that as we will be entering the next week, I know there are a lot of curfews, as you just clarified, that have been put in place. But what are some of the other measures that have been taken in order to ensure that there isn't a massive escalation in these tests, and how medically we have processes in place in order to administer the overall situation?
Oh, as I told, that today's measures which we had taken are quite stern in nature, I mean to say, and prior to that we had taken many measures, like we have totally stopped schools from 1st to 12th, and even the senior colleges has been stopped. There's no college or school open at present. The exams has been postponed. Also, the Public Service Commission exams, all types of exams has been postponed. And even we are totally asked not to conduct any gathering, religious, public gathering, or even there's no government functions allowed, even no political functions allowed. There are even in some of the crowded places, some of the police officers has also invoked the 144 section of IPC, and so there should not be a much crowd over there, not more than 10% at one point of place. Then also further adding to this, I just wanted to put to your knowledge that yes, even the social gathering places like swimming pools, museums, and health clubs and all, everything has been closed just to stop, or just to not to so that infection should not take place. And I think these are some of the measures which we had taken. And there is a Epidemic Disease Act 1897, which we have invoked, and by virtue of that act and the provisions of that act, a lot of power has been given to the government and to the administrative authorities to take the necessary action in the larger interest of public, so that this infectious disease should not be a problem.
Sure. Right. Mr. Tope, what is it that you're doing in terms of treatment? Because, just last night we heard the US President Donald Trump actually okaying chloroquine as as a treatment drug. I know the vaccine is still a good 1 to 2 years away, who knows when. Are you okay in terms of supply on essential drugs to treat the virus right now? I know the cases are as limited as 52 only in Maharashtra, and touch wood for that. But how equipped and how supplied are you in order to really avail the best treatment facilities?
You see, as I told you, that the ICUs are kept ready even the ventilators, and even the private hospitals. We have asked them to provide us isolation beds and all. So they have also voluntarily provided lot of isolation beds. I think we are the treatment plan. We are quite confident, but yes, considering the scale of Maharashtra, the population of 12 crores, we cannot suffice to that much of treatment if it goes to phase 3, phase 4, or so. We are hoping that we should not go in phase 3 at all, so that we have taken a lot of steps in this regard, that Maharashtra should not witness stage 3.
Okay, thanks so much for joining us and taking us through. Thank you.